So if you look at truly practice-changing randomized trials, there's one randomized trial for frail patients with newly diagnosed myeloma, and in this trial they compared two different two-drug regimens. So one of them was daratumumab and Revlimid versus Revlimid and dexamethasone. Now, big credit to the authors of this trial is that this is the first randomized trial done exclusively for a frail population with myeloma. The frailest, oldest patients are usually excluded from clinical trials. So they showed that the two-drug combination of daratumumab and lenalidomide was better than lenalidomide and dexamethasone. It was quite convincingly better. The PFS was more than double for the daratumumab and the lenalidomide arm. What is really compelling about this trial is that dexamethasone steroids, which cause a lot of side effects, were not part of the long-term daratumumab lenalidomide arm. So they got steroids for the first 2 months, and then after that the steroids were dropped. Despite the dropping of the steroids, the efficacy of daratumumab and lenalidomide was great. So that is something that I can take to my practice, that this further validates my desire to get rid of dexamethasone early, especially for frail patients. There are some other studies being presented in the newly diagnosed space. Like, we have some early phase data about bispecifics, different bispecific products for newly diagnosed myeloma. I don't think that they are changing my practice yet because those drugs are not approved. We will need to see some larger studies, but that's the one thing that's changing for newly diagnosed myeloma, the frail study that I mentioned.